Hello, dear colleagues. My name is Dmytro Chumachenko. I represent National Aerospace University Kharkiv Aviation Institute, and today I will briefly tell you about research of my group, which is connected with simulation of epidemic process. So, as I said, I represent the National Aerospace University Kharkiv Aviation Institute. This is a huge university in Kharkiv where all the information technology industry specialties are represented. Life was in full swing at the university, and thousands of students sought to receive a quality technical education. However, more than a year ago, Russia invaded Ukraine with a full-scale war, and our university's campus received 160 rockets and bombs, which destroyed parts of the buildings and infrastructure. However, it didn't break the people who continue to engage in science and bring the victory to Ukraine closer. This is evidenced by the number of Kharkiv Aviation Institute representatives participating in this conference. We have 14 reports during the following 4 days. So I urge you to listen to my colleagues' reports and go to Gather Town, get to know them better, because now I will only talk about just a small part of the research being implemented at our university by my team during last 7 years. So as I said, I will tell you about epidemic diseases problem and its simulation. So the problem of emergent diseases spreading is a genuine and urgent concern. With increasing globalization, human activity encroaching on previously distributed ecosystems, there are more opportunities for zoonotic diseases to jump from animals to humans. Also, climate change, antibiotic resistance, and population growth can exacerbate the spread of these diseases. To solve the problem of biological safety, it's necessary to clearly understand the mechanisms of developing the epidemic process of a particular infectious disease, assess the leading factors for its occurrence and intensification, have an adequate tool for predicting and controlling the spread of infections among society, creating conditions for a timely response and warning of the population. So as I said, today I will briefly talk about the results of my research group during the last 5 years. So first of all, I want to start with a novel concept of epidemic process simulation based on a combination of several modeling approaches. The most accurate, as I will show further, are models based on machine learning. However, their main disadvantage is the difficulty of interpretation. Models based on the agent-based approach cope well with interpretation. Therefore, we use a hybrid model based on an agent-based model, which is tuned to the prediction obtained by the machine learning model. So we get an explainable high-precision model of the epidemic process. And to implement the proposed concept, a modular information system has been implemented that contains a bank of machine learning models and population models that can be combined and used to solve various applied problems for various infectious diseases. So now let's return to approaches that allow us to study the epidemic process. And as I mentioned, the most accurate models are based on machine learning. We have achieved an accuracy over 99% based on various methods, not only by that as shown on the slide. Besides, the model's analysis results showed that using cumulative case and death data as input increase the accuracy of the models, which at first glance is attractive and may lead to the misconception of not using data on daily new cases and deaths. However, the evaluation of models using absolute error shows a much smaller absolute error. Based on the obtained data, it should be concluded that to build models, it's necessary to use entire set of available data, both daily and cumulative, giving a preference to cumulative data during periods full of holidays and weekends, and daily data in other periods. The second important approach is the agent-based approach. As an example, the slide presents an agent-based model of the COVID-19 epidemic process. With its help, we measured the required level of vaccination and the influence of various factors on the dynamics of COVID-19 during the first wave of the pandemic in Ukraine. The experiments were carried out on actual data for all regions of Ukraine. The experiments carried out not only speak about the effectiveness of self-isolation, they also tell us how many people need to stick to it to be effective, and that similar pandemic control outcomes have been observed with 78% and 100% of population being isolated. And it also tells us that isolation by itself cannot eradicate the disease. So let's move on to the practical tasks that we implemented. The main task that epidemic process simulation solves is forecasting. In this case, a short-term forecast is usually sufficient to understand the behavior of an outbreak for public health authorities to develop and implement the necessary measures to reduce epidemic incidence. The slide shows that the result of predicting the incidence of hepatitis B in Kharkiv region for the Kharkiv Regional Center for Disease Control. In some cases, it's necessary to look at more extended long-term, many years dynamics of the incidence to plan the resources needed to control the epidemic process. The slide shows the results of long-term forecasting of HIV incidence in Ukraine for all Ukrainian Center of HIV/AIDS. And forecasting is also used in conjunction with other tasks, for example, to calculate epidemic thresholds. So based on long-term data on the incidence, an epidemic forecast for the coming season is calculated. And if the predicted incidence exceeds the constructed threshold, the epidemiologist must implement urgent measures to prevent the epidemic. So we have developed and implemented in Kharkiv and Dmytro a software package for controlling the incidence of influenza and ARVI. And based on the results of the software in Kharkiv, school quarantines were introduced several times, which not only prevented influenza epidemic, but also made Kharkiv the city with the lowest incidence of influenza and ARVI in Ukraine over the past 12 years. Another essential task is identifying the factors influencing the epidemic process. To do that, so the graph shows results of agent-based model of syphilis developed for the Kharkiv venerological dispensary. The model results showed that the most influencing factor is the frequency of disease checks and isolation of patients. The second most crucial factor is the constancy of the sexual partner. The third one is the use of contraceptives. And finally, the fourth is the number of variable partners. The simulation results allows to determine the direction of prevention of treatment of syphilis and the main factors in reducing the incidence. As can be seen from the simulation results, social factors prevail over medical ones, which gives ground for conducting an explanatory health policy among the population, especially among the young people. So this slide shows determining the necessary immune layer for disease control, and agent-based model built for Kharkiv City Center for Disease Control calculated the percentage of the population that needs to be vaccinated to completely eliminate the incidence of measles and Zika. Measles is an infection controlled by immunoprophylaxis, so it can be eradicated entirely worldwide if enough people will be, if enough people are immune. So the model shows that 93% of children should be vaccinated with the first measles vaccine. Unfortunately, such measures didn't implemented. in Ukraine, so several measles outbreaks were observed in our country. Another task we solved in the context of the fight against COVID-19 for the Public Health Center under the Ministry of Health of Ukraine was to identify clusters with similar dynamics of the epidemic process. And to do this based on the neural networks, clusters were identified based on the nature of the dynamics of the epidemic process. And combining areas into such clusters allows for a combination of control and limiting measures, which reduces the response time and costs for implementing control measures. So Russia's military invasion of Ukraine in February, on 21st of February 2022, affected public health as well, worsening the epidemic situation in the country. Therefore, since the beginning of the escalation of the Russian war in Ukraine, we have also been working on assessing the impact of the war on the dynamics of the epidemic process in Ukraine and the countries that hosted the most significant number of refugees. To do this, we propose a methodology based on machine learning models that is verified on the data before the Russian military invasion of Ukraine starts. The model is then applied to the period after the beginning of the full-scale war, and the difference in the accuracy of the model applied to different samples is evaluated by epidemiologists, and the correlation with migration flows caused by the Russian war in Ukraine is also being studied. The results show that the war has dramatically affected the dynamics of COVID-19 in Ukraine. The main factors that influence the worsening of the epidemic situation include non-compliance with preventive measures, shelters and evacuation transport, difficulties in assessing medical care, mental perception of epidemiological threats as unimportant, and so on. However, experimental studies have shown that the flow of forced refugees to European countries didn't become a factor that would worsen the epidemic situation in these countries. So, and finally, we are working on an online dashboard for emergent disease control. You can see the MVP of it on the slide. It includes collecting real-time incidents, analyzing them by country, and modeling future dynamics. So it's collected cumulative, daily, and fatal cases for different infections from different sources. You can select source, you can select the data sample, period, or country, and also the dashboard allows us to provide a simulation with different assumptions for different countries. So within the simulation provided by the dashboard, you can find the factors influenced the epidemic process and also the simulated dynamics of epidemic process, as well as forecasts for different periods using different models. So basically, that's all I wanted to tell today. Let's find possibilities of collaboration. You can connect me by any social network. And yesterday I created a channel Health Informatics on our Slack channel. So please join and let's find collaboration opportunities with UK. And the last point I wanted to say is that to help Ukraine now, to help Ukrainian science now, we need to help Ukraine to win. So I ask you to donate for weapons and for arms for Ukraine to make our victory closer. Thank you very much.